After this presentation, and Your Royal Highnesses, you have the presentation I'm about to present.
Assalamu alaikum. I welcome all NTLC members, National Primary Healthcare Development Agency staff, development partners, and particularly the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, to this emergency meeting on the community engagement framework for increasing demand for routine immunization RI services. We thank Almighty Allah for bringing us all safely here today. Recall that earlier this year, when the country had gone about 15 months without any polio case, we proactively convened a special meeting to strategize on how NTLC can systematically support routine immunization alongside polio eradication initiatives. To sustain the gains being made in the polio eradication efforts, I recall that at that meeting, we reviewed and commended the Kano State initiative in community engagement framework and took far-reaching decisions on how we would rapidly scale up this model and harmonizing similar ones to ensure that health facilities in our communities are offering quality routine immunization services. I am aware that some of you have been very innovative in your efforts to support routine immunization services, even though most of the resolutions we made at our special meeting could not be implemented due to some factors. Today's meeting is therefore commendable as it reflects the fact that we are determined to support any effort to improve the health of our people with or without external support. We are therefore glad that the federal government, through the Federal Ministry of Health, the National Primary Healthcare Development Agency, and the development partners, is now paying special attention to community engagement through the direct involvement of traditional and religious leaders as part of its ongoing efforts to rapidly increase routine immunization coverage to boost population immunity against childhood killer diseases. It is important to note that the involvement of the Northern Traditional Leaders Community in the expanded program on immunization resulted in a remarkable improvement in community acceptance and participation, and ultimately a significant increase in number of children vaccinated with oral polio vaccine, leading to the interruption in the transmission of wild polio virus, WPV. The dramatic improvement in polio eradication activities in Nigeria, which have been sustained to date by the NTLC, has resulted in the absence of WPV in the country for over 25 months now. This positive development notwithstanding, routine immunization remains very low in our communities, with many children dying of vaccine-preventable diseases. Northern Nigeria is blessed with a traditional leadership system that has deep-rooted influence and relevance in the minds and daily lives of our people. traditional and religious institutions have continued to serve the interests of our people and responding to their welfare and needs. The Northern Traditional Leaders Committee, however, urged the federal government, development partners, and other stakeholders to ensure a successful rollout of this important national strategic endeavor to create sustained demand for routine immunization. Today's emergency meeting is therefore convened to enable us to review the harmonized version of community engagement framework and the guide on how to improve it with a view to increase demand for routine immunization services and consequently fast-track the eradication of polio in our communities. As usual, please let's be frank, very frank in our discussions. Let's be open with whatever challenges are hindering our effective implementation of the framework in our domains so that we can collectively agree on the next steps and roll out plans with the technical guidance of the National Primary Health Care and other partners.
Engagement framework that really defines how the traditional fathers, our religious leaders as well, engage with their community. We've sat with traditional leaders all across northern Nigeria to get their input into how they engage with their communities towards strengthening primary health care, especially routine immunization. We've seen historically that because the traditional leaders were involved in polio eradication, we've gone 25 months now without a single case of white poliovirus that has been reported. It is exactly the same pathway we're taking with routine immunization. You recall that a few years ago in 2016, we had very poor routine immunization coverage. Now, working with the traditional institution, again, we're beginning to see an increase in routine immunization coverage. What we're doing here today is to symbolize how that engagement happens, how the traditional institution is involved in line listing children once they are born, ensuring that they go to the health facility for the vaccines, and then when there's an outreach in their communities, ensuring that all eligible children are provided with the vaccines. And if, peradventure, either by omission or commission, any child misses their vaccinations, the traditional institution, our traditional leaders, will actually help track those families and ensure that those vaccines are given free of charge. So for us, we're really excited about what this really represents. So at the end of today, there will be manuals that all levels of traditional institutions will actually take home that describes their roles and responsibilities in a way that is easy to understand, in a way that they can also take back to their communities and really cascade down in terms of training the lower level traditional leaders.